Number 1. Most common sign associated with decreased cardiac output is option A. Shortness of breath, option B. Peripheral edema, option C. Cardiac murmurs, option D. Arthritis. Correct answer option A. Shortness of breath. Second, heart sounds are the result of option A. Movement of blood into the heart from the aorta, option B. Blood flow through the heart, option C. Closure of the heart valves, option D. Contraction of the cardiac muscle. Correct answer option C. Closure of the heart valve. Number 3. When listening to heart sound, you can best hear sound at the option A. Base of the heart, option B. Apex of the heart, option C. Aortic area, option D. Second ICS to the left of sternum. Correct answer option B. Apex of the heart. Fourth number. Ventricular valves. Option A S1, option B S2, option C S3, option D S4. Correct answer option C S3. Number 5. S1 heart sound corresponds to option A. Closure of the aortic and pulmonic valve, option B. Closure of the aortic valve, option C. Closure of the mitral and tricuspid valve, option D. Closure of the mitral valve. Correct answer option C. Closure of the mitral and tricuspid valve. Number 6. AS2 heart sound corresponds to option A. Closure of the aortic and pulmonic valve, option B. Closure of the aortic valve, option C. Closure of the mitral and tricuspid valve, option D. Closure of the mitral valve. Correct answer option A. Closure of the aortic and pulmonic valve. Number 7. Which is the longest vein in the human body? Option A. Great Saphenous, option B. Popliteal, option C. Iliac, option D. Femoral. Correct answer option A. Great Saphenous. Eighth number. Largest vein is option A. Superior vena cava, option B. Saphenous, option C. Inferior vena cava, option D. Jugular. Correct answer option C. Inferior vena cava. Number 9. Connection between artery and vein is known as option A. Capillaries, option B. Arterioles, option C. Venules, option D. Limbs. Correct answer option A. Capillaries. Number 10. The network between the arteries that supplying to a particular area is known as option A. Collateral arteries, option B. Anastomosis, option C. Capillary network, option D. Vena caval junction. Correct answer option A. Collateral arteries. 11th number. The largest artery of human body is option A. Aorta, option B. Carotid artery, option C. Subclavian artery, option D. Pulmonary artery. Correct answer option A. Aorta. 12th number. Artery in anatomical snow box is option A. Radial, option B. Brachial, option C. Ulnar, option D. Interosseous. Correct answer option A. Radial. 13 number. Identify the blood vessel which carry blood into right atrium. Option A. Inferior vena cava, option B. Superior vena cava, option C. Pulmonary vein, option D. Both A and B. Correct answer option D. Both A and B. 14 number. Identify the blood vessel which carries blood into left atrium. Option A. Inferior vena cava, option B. Superior vena cava, option C. Pulmonary vein, option D. Both A and B. Correct answer option C. Pulmonary vein. 15 number. Largest artery is option A. Aorta, option B. Carotid, option C. Coronary, option D. Femoral. Correct answer option A. Aorta. 16 number. Largest branch of vertebral artery is option A. Middle cerebral, option B. Posterior cerebral, option C. Posterior inferior cerebellar, option D. Posterior superior cerebellar. Correct answer option C. Posterior inferior cerebellar. 17 number. Posterior cerebral artery is a branch of which of these? Option A. Vertebral artery, option B. Basilar artery, option C. Posterior cerebral artery, option D. Posterior choroidal artery. Correct answer option B. Basilar artery. 18 number. Terminal branch of internal carotid artery. Option A. Anterior choroidal artery, option B. Anterior cerebral artery, option C. Ophthalmic artery, option D. Inferior hypophyseal artery. Correct answer option B. Anterior cerebral artery. 19 number. Not a branch of external carotid artery. Option A. Inferior thyroid artery, Option B, facial artery. Option C, superior thyroid artery. Option D, maxillary artery. Correct answer option A, inferior thyroid artery. 20 number. Smallest vein is option A, veneous. Option B, capillaries. Option C, lymph. Option D, arterioles. Correct answer option A, veneal. 21 number. Smallest artery is option A, arterioles. Option B, veneals. Option C, capillaries. Option D, lymph. Correct answer option A, arterial. 22 number. Vein used in bypass surgery. Option A, great saphenous vein. Option B, short saphenous vein. Option C, femoral vein. Option D, brachial vein. Correct answer option A, great saphenous vein. 23 number. Which of the following is an artery of the forearm? Option A, brachial artery. Option B, axillary artery. Option C, ulnar artery. Option D, femoral artery. Correct answer option C, ulnar artery. 24. Great saphenous vein is present in dash body part. Option A, trunk. Option B, spinal cord. Option C, abdomen. Option D, legs. Correct answer option D, legs. 25th. The innermost layer of blood vessel is option A, tunica media. Option B, tunica adventitia. Option C, tunica intima. Option D, tunica mucosa. Correct answer option C, tunica intima. 26. Base of the heart is formed mainly by option A, right atrium. Option B, left atrium. Option C, right ventricle. Option D, left ventricle. Correct answer option B, left atrium. 27. Major part of the myocardium is drained by option A, coronary sinus. Option B, great cardiac vein. Option C, anterior cardiac veins. Option D, vena cordis minimi. Correct answer option A, coronary sinus. 28. The left subclavian artery is a branch of option A, brachiocephalic trunk. Option B, ascending aorta. Option C, arch of aorta. Option D, left common carotid. Correct answer option C, arch of aorta. 29. Posterior communicating artery, a branch of option A, posterior superior cerebellar artery. Option B, external carotid artery. Option C, middle cerebral artery. Option D, internal carotid artery. Correct answer option D, internal carotid artery. 30 number. Branches of brachial artery are all except option A, profound brachii. Option B, superior ulnar collateral. Option C, inferior ulnar collateral. Option D, radial collateral. Correct answer option D, radial collateral. 31. Cephalic vein drain into option A, brachial vein. Option B, subclavian. Option C, axillary vein. Option D, inferior vena cava. Correct answer option C, axillary vein. 32. Right common carotid artery arise from option A, right axillary artery. Option B, arch of aorta. Option C, brachiocephalic artery. Option D, left subclavian artery. Correct answer option C, brachiocephalic artery. 33. Branches of left coronary artery are all of the following except option A, anterior intraventricular branch. Option B, left diagonal artery. Option C, left atrial artery. Option D, posterior interventricular branch. Correct answer option D, posterior interventricular branch. 34. All of the following drain into coronary sinus except option A, great cardiac vein. Option B, small cardiac vein. Option C, middle cardiac vein. Option D, anterior cardiac vein. Correct answer option D, anterior cardiac vein. 35. Agiogous vein opens into option A, inferior vena cava. Option B, superior vena cava. Option C, right brachiocephalic vein. Option D, left brachiocephalic vein. Correct answer option B, superior vena cava. 36. Femoral ring is bounded by all except option A, inguinal ligament. Option B, superior ramus of pubis. Option C, femoral artery. Option D, femoral vein. Correct answer option C, femoral artery. 37. All are branches of internal iliac artery except option A, ovarian artery. Option B, superior vesical artery. Option C, middle rectal artery. Option D, inferior vesical artery. Correct answer option A, ovarian artery. 38. All of the following veins in the body leak lack valves except option A, femoral vein, option B, portal vein, option C, IVC, option D, dural venous sinuses. Correct answer option A, femoral vein. 39. Which of the following is valveless? Option A, portal system vein, option B, saphenous vein, option C, popliteal vein, option D, ulnar vein. Correct answer option A, portal system vein. 40. Veins are an example of option A, conducting vessels, option B, distributing vessel, option C, resistant vessels, option D, capacitance vessel. Correct answer option D, capacitance vessels. 41. True about valves in portal venous system. Option A, present at the junction of superior mesenteric artery with the splenic artery. Option B, within the portal vein only. Option C, whole system is valveless. Option D, in the intrahepatic portion of portal vein. Correct answer option C, whole system is valveless. 42. IV infusion is avoided in option A, long saphenous vein, option B, cephalic vein, option C, external jugular vein, option D, internal jugular vein. Correct answer option A, long saphenous vein. 43. Aneurysm affects which layer of the artery? Option A, tunica intima, option B, tunica media, option C, tunica adventitia, D, option D, all of the above. Correct answer option B, tunica media. 44. The breath sound that can be found anteriorly and posteriorly in the lung field is called option A, bronchial, option B, vestibular, option C, wheeze, option D, crackle. Correct answer option B, vestibular. 45. Bronchial breath sound should be assessed in option A, tracheal area, option B, clavicular area, option C, mid axillary area, option D, none of these. Correct answer option A, tracheal area. 46. The apex of the lungs is ausculted at option A, 7th intercostal space mid clavicular line, option B, 5th intercostal space mid axillary line, option C, slightly above the clavicle, option D, 4th intercostal space mid clavicular line. Correct answer option C, slightly above the clavicle. 47. The right middle lobe of the lung is ausculted at option A, anterior to the fourth intercostal space, option B, posterior to the fourth intercostal space, option C, between C7 and T5, option D, between T3 and T7. Correct answer option A, anterior to the fourth intercostal space. 48. High pitched harsh sound during inspection is called option A, rants, option B, raunchy, option C, stridor, option D, wheezes. Correct answer option C, stridor.